morning, all. My name is Brittany Berlin, and I'm a rising sophomore at Florida Atlantic University High School located in Boca Raton, Florida. For those of you watching the recording, today is July 16th of 2022. As previously mentioned, I live in the Sunshine State, Florida. While we are renowned for our gorgeous coastlines and beautiful sunsets, what we are less known for is our high rates of skin cancer. After noticing many elders in my community being unfortunately diagnosed with this disease, I decided to research it and present it to you all here today through my presentation entitled Skin Cancer, a Growing Public Health Crisis. So to start off our introduction, let's go over some statistics. Skin cancer is the most common type of cancer globally, as for every 1 in 3 cancers diagnosed, it is skin cancer. Within skin cancer, there are 2 broad classifications: melanoma and non-melanoma. Today, I have 2 examples for you of non-melanoma skin cancer lesions. These are basal cell carcinomas and squamous cell carcinomas. Basal cell carcinomas present themselves as small, pearly nodules, and squamous cell carcinomas typically have scaly plaques or patches on them. Melanoma, on the other hand, is very dark, large, and asymmetrical. Speaking of color, it often has multiple dark hues within it. Skin cancer does have a great global significance, and the US alone spends over $8 billion per year just on treating skin cancer. That doesn't even include the cost for research, and the prevalence of skin cancer does exhibit geographical variation, with Australia and New Zealand being amongst the highest. So, what are the risk factors for getting skin cancer? Well, there are definitely some predisposing influences. For example, the presence of arsenic in water sources within developing nations can cause residents of that country to be at a heightened chance of being diagnosed with skin cancer. Moreover, exposure to sunlight with history of multiple sunburns does play a big factor. In fact, it is estimated that minors, or those under the age of 18, who have already experienced just a mere 3 sunburns are at a heightened chance of diagnosed compared to those who have experienced 2 or less. Moreover, geographical factors do play a role. For example, if you live in the southern hemisphere with a higher UV radiation, then you are at a heightened chance of getting skin cancer compared to someone who lived in the northern hemisphere. Climate change is also key in the current epidemic, particularly the depletion of the ozone layer and the increase in temperature. As for every 10% decrease in the ozone layer, there will be 4,500 melanoma cases and an additional 1,000 non-melanoma cases being diagnosed. And for every 2 degrees Celsius increase in temperature, there will be an 11% global increase in skin cancer by the year of 2050, which isn't that far away. So, solutions. What can we do to stop this? Well, education is key. We must regularly complete skin surveillance examinations and promote to those around us why we should wear sunscreen outside, as well as sun protective clothing. Self-examination should be based off of the ABCDEs of melanoma. A stands for asymmetry. Melanoma typically is not in a clear-cut shape, henceforth not have symmetry because of its B. Border is not a clear-cut pattern, compared to other lesions, which typically present themselves in a circular or an oval pattern. The color also differs, as melanoma not only is darker than a typical lesion, but also multiple hues within it and is much larger for our D diameter. Lastly, the evolution of melanoma is typically rapid and it progresses over time. Of course, we cannot solely rely on one or all of these factors to diagnose ourselves with melanoma, and to be properly diagnosed, you should visit a board-certified dermatologist. Additionally, public policy interventions fail. We must promote environmental initiatives to restore the ozone layer and fight the current climate change crisis, as well as promote legislation to ban the use of tanning beds and infrastructure to support shaded areas and public places, such as parks and popular walkways. So, conclusions. Skin cancer is ultimately a global epidemic that affects billions of people worldwide and requires thousands upon thousands of dollars annually just to treat. Additionally, given the increased incidence of skin cancer, public health measures must be and self-education, governmental intervention, and infrastructure construction can reduce the current skin cancer rates and overall improve global skin health internationally. So, what's next? Advocation is certainly key. In fact, I challenge all of you here today to talk to 3 people, peers, family members, friends, you name it, about what you've learned in this presentation and what they can do to reduce their chance as well as curbing the overall rates. Also, I want to start a social media chat. I challenge all of you to duet my TikTok video with my familial members, seeing who could put on sunscreen the fastest, and use the hashtag sunscreen challenge to promote sunscreen use with the general public. And for more information, please visit the American Academy of Dermatology at aad.org or read my pending publication in the Pre-Collegiate Global Health Review entitled Skin Cancer, a Growing Public Health Crisis. Here's my contact information. My email is bberlin2021@fe.edu. And if you decide to duet the TikTok video, it is Brit_Berlin. Here are my references, and thank you all for your time and attention today. I'd also like to thank my father for his endless support and the wonderful research team at Florida Atlantic University High School. I would not be here without all of you today. Thank you again to the audience for all of your attention, and I hope you have a great morning.